today I'm here with Dr. Thompson Maesaka, and he is specializing in headaches. He is the founder of the Minnesota Center for Chronic Headache, which just recently opened. So, congratulations, Dr. Thompson.
Thank you very much.
And today he's here to talk with us all about headaches post injury. So, welcome to the podcast.
Thank you so much for having me, Christabel. I've been looking forward to this for a while.
So glad to have you. So, do you want to share a little bit about yourself and your training and your background for our listeners?
Yeah, absolutely. As you said, my name is Dr. Thompson Maesaka. I live in Bloomington, Minnesota. And I went to school specifically for something that you've probably heard if you've listened to Christabel for a while. It's called functional neurology. So I kind of came into school knowing that that's what I wanted to do. So I went to a school called the Carrick Institute and sort of handpicked courses that supported that throughout school so that I could kind of come out and be specific to the neuro rehab of headaches. Specifically, my area of focus is mostly migraine and a lot of post-concussion headaches that are kind of walking around as migraine. There's a lot of overlap there. You mentioned that we just opened up our clinic, which is also in Bloomington, Minnesota. It has been a crazy whirlwind of many different types of emotions so far, but mostly amazing. It's been such a journey and a incredibly fun ride so far. I can't wait to see where it goes moving forward. A little bit about myself. Christabel and I have bonded over this before. I'm also a musician, as I'm sure you know that she is as well. Not quite as well-rounded as her. I'm just a drummer, but that's been a huge source of fun and therapy in my life, as I'm sure we'll talk about. I've also recovered from a brain injury, just concussions and sports stuff growing up. So I'm very well aware of the struggles that people go through, and I love kind of relating to that. That's a huge source of empathy and fulfillment in this work, is being able to kind of meet people where they're at and really just feel their struggle. Because when you have an invisible struggle that is really hard to put into words, sometimes just having somebody that is able to communicate that struggle with you is like hugely therapeutic. So it's very nice when we're able to do that. So yeah, thank you so much for having me on, and let's nerd out a bit, huh?
Yes, sounds great. All right, so let's get into it. Now, how would you define like post brain injury, post concussion headaches?
Oh man, they show up in so many different ways. I'd say two of the most common ones are sort of what feels like a stress headache or more of a tension headache. A lot of people will describe it as a sort of a dull pressure above their eyebrows or sort of on top of their head. And the very common symptom presentation when those headaches are around is an elevated heart rate or an elevated blood pressure. And you see that a lot with post-concussion headaches, is the system is just so revved up for a long period of time and has a lot of trouble coming down from the rafters. It's you have either an excess of stress from the concussion, or you've affected the areas that kind of wind you back from stress. So from our perspective, people that do this work, that's what we have to figure out first is your headache because of a stressor, or is it because of a lack of ability to take you out of stress? It's very easy to kind of just go after the stress, but then you see enough of them and you realize very quickly you have to investigate both sides. So autonomic headaches is a nice umbrella term that you could lump that under. Another really common type that I've struggled with, and I believe you have as well, is that really stubborn top of the neck. Like you just want to like dig your fingers into it, but it doesn't seem to ever respond to anything. Super common to see with lots of ocular dysfunction. It's a cool test I always tell people to do on themselves is you find the notch on the back of your skull, go down about an inch and then out an inch, and then move your eyes all over. Actually feel your muscles on your neck twitch. So it's kind of a lesson in how intimately connected your eyes and those muscles called the suboccipitals are. So if you have a dysfunction in how your eyes track, or if they don't look from one thing to another very well, the system, because it's so integrated, will just juice up that neck tension in order to give that system more energy. And then that will present as those headaches that are really, really resistant to chiropractic, to manual therapy. If there's any chiropractors listening, they can immediately think of patients where they're like, I did everything right. I don't know why they're not responding. a lot of times in post-concussion care, it's because of those ocular dysfunctions that we test for that you've had tested on you many, many times. So without getting too into the weeds, those are probably the two most common that I see. And then there are a whole bunch of subtypes, basically just based on what happened.
Hmm. Yeah, that's so interesting. I like how you explained it because when you're in it, I mean, and you're in pain, all you like, you can't think, you can't do anything. You're just kind of like stuck in this, it hurts and I don't know why. And I tried to drink more water and it still didn't go away. Sometimes drinking more water helps if it's a dehydration situation, but sometimes there's something stubborn and more. And I get people in my online support group telling me, like, I've tried everything, no matter what I do, my headaches will not go away. And I find it interesting that you mentioned stress. And when you say stress, can you explain how like a concussion can cause stress? Because I feel like stress is a very vague term because somebody would think, oh, I'm stressed because, I have this situation at work or I have this or whatever. But stress is more than an emotional thing, correct?
Absolutely. That's such a great point that you bring up. It's really helpful to understand the difference. And so you can take normal stress, emotional stress, like you said, something at work, something, anything that you're really struggling with. And then you can look at a situation like a head injury. So a great example that's really relatable is if you've ever been sort of sitting at a stop sign and the car next to you starts to either move forward or backwards. And you're not sure if it's you that's moving and you kind of slam on the brakes and you get nauseous. And there's like this brief instance when you kind of freak out a little bit. That's called a sensory mismatch. It's ubiquitous in the concussion world. And it's when two or more senses are saying conflicting things. So in the car analogy, your visual system picked up movement, but your body was telling you we're not moving. So that difference in sensory input caused a little bit of a stress response. And in concussions, that's kind of the first thing that we look for is we look at your vestibular system, see if your eyes are moving around. We look at your ocular system to see if you can track things and just follow your environment. And then we look at your neck. And so if any of those three systems are saying different input coming in, that will manifest as stress. That is just a slow dripping source of never ending stress until you actually figure out what's wrong and fix it. And then that can create a chemical environment in your body that over time you just kind of latch onto emotionally. So in the same way that you can think your body into stress, your body can create stress that you latch onto emotionally. So if you get somebody post concussion that has a lot of anxiety issues or a lot of just chronic stress, a couple of things will happen because of that. But the first thing in order to relieve it is to figure out, okay, what parts are emotional and what parts are behavioral and what parts are just coming from your body. So other sources of stress that can kind of manifest as emotional stress are things like infections. Immune system function can drop pretty dramatically after a serious TBI. So making sure that old latent infections haven't sort of reactivated, sort of caused that chemical stress. Food intolerances can cause it. If you have any sort of active stomach infection, that can cause this slow drip of stress. So even just from the person that's experiencing the stress, I've found it's really helpful to know that a lot of it's not really your fault. If you're a very anxious, high stress person, a lot of that could just be coming from your body. And so it's nice to know that it's not just you creating stress for yourself. It's kind of comforting to know that it could just be your body.
Yeah. Well, yeah. And after a brain injury, your body's kind of thrown into chaos. I mean, your nervous system, which regulates pretty much everything, is having issues, needs some needs some extra TLC. And if it's not getting it, I think of all the little stressors of like when you get overwhelmed, when you get confused. I think about even going into a grocery store and getting so overwhelmed that like you just freak out and you can't function. And, that's when your heart rate starts to go up. You start to get really anxious because you're overwhelmed and you're confused. You can't remember what you came for. I mean, all of that causes stress. Like all of our symptoms is constantly going to be causing stress on our body and on our system. So when we say stress, it's not, I think what you're trying to say, Dr. Thompson, is that it's not necessarily something you can always control.
Yeah, absolutely. And it's not necessarily something that you're causing with your thoughts alone. Sometimes it can feel like, oh, I have anxiety, so it means that I'm just anxious. And I think separating yourself from that is
Mm.
helpful in managing it, just knowing that you're not crazy, or you're not, just an anxious person.
Yeah, that's so good. All right. So you mentioned, these tension type headaches, as well as like, would you call them migraine type headaches?
Yeah, we could. Migraine is a very misunderstood monster, but a lot of things get kind of lumped in with it. But yes, a lot of post concussion headaches will present very similar to migraine.
Okay. And that's like, the back of the head pain but you mentioned it can come from eye movement dysfunction.
Yep.
So that's really interesting because it's very, very common for your eyes to not work together after a brain injury. I never thought about that causing issues in your neck, in your back of your head. So it's so. I just want you guys to, as you're listening to this, just I hope that you're breathing a little bit of a sigh of relief of like, if you've had constant headaches, that there are reasons for it. There are things that can be done to help.
Yes, many. It's just got to know where to look, and that's where I've been blessed to have the education that tells you exactly where to look. I can't say enough about the Carrick Institute. They are just world class in every way, and I feel so thankful to have found them. They just prepare you so well to deal with this stuff, and that's a great thing to kind of look for if you're out there and you're hearing some of these things and you're like, yes, like I'm finally starting to feel like someone is directing me in the right direction. Look for somebody that's been trained at the Carrick Institute. They are just a cut above. I can't say enough good things about them.
All right. Thanks for that.
Yeah, you're welcome.
So, all right, let's talk about we've gone over an overview of the types of headaches and talked about how stress or different factors can create them. Can we just go a little bit deeper? I know that a podcast format is limited to how much you really can offer direction because it's very personalized to each person. But if you were to generally say, like, most concussion patients maybe has this kind of headache, and what are things they can do to help it?
Yeah, absolutely. So one of the best things, the universally helpful thing that anyone can do at any stage in their recovery is a graded cardiovascular exercise protocol called the Buffalo Concussion Test. And it's really easy to look up. The PDF for how to do it is online. And if you do have some of those headaches that as you get fatigued, you kind of feel this pressure on the top of your head. Sometimes it can feel almost like a headband around your eyes. And you just feel like you're kind of just revved up and redlined for too long throughout the day. The concussion protocol is a great way to start rehabbing that autonomic system. And so how it works on just a very high level is you basically just walk on a treadmill very slow, and then you walk, increasing the incline every minute until you feel symptoms. So let's say hypothetically you're 140 beats per minute and you start to feel kind of bad, you get that headache. Then you take that heart rate, so for this example 140, and times it by 0.8, and then you exercise at that heart rate for 20 minutes every day. So every couple of weeks you retest, and if it's working, you should be able to get higher up in heart rate before you get symptoms. And so the goal is, let's say you do that for 2 months and then you run the tests and you can't produce symptoms for yourself, then your autonomic system is doing much better. It can handle a lot more stress and sort of recovery. So for anybody recovering from a head injury that's really struggling to keep their energy up throughout the day, that is a fantastic way to start, both from an autonomic perspective, and then all of the chemicals that come out to play when cardio is present is brain recovery gold. Interesting fact, there is one very special place in your brain that's able to create new neurons and plug them in and use them. It's called the hippocampus, and it has to do with storing memories. And so if you're struggling with memory, the best thing to do to improve that is cardiovascular exercise, because it sort of just floods that area with neurochemicals that make that new tissue. And then your memory improves over time. I always thought that was the most interesting thing, that your brain has one place that can actually just like sprout new brain cells and then use them. and it's all because of cardio. So great place to start if you have those, I call them autonomic headaches, but if you don't know what that is, it's pressure headache, I guess is a good word for them. You've had those before, yeah?
Oh yeah. Yeah.
Feels like something's just kind of sitting
Yeah.
on your forehead.
Especially like behind my eyes. Like it's just like will not go away. Yeah.
Yeah, so if you struggle with those, that's a good place to start. If you struggle with the headaches at the top of your head,
The top of the neck, you mean? Like behind your head?
top of the neck, sort of right beneath that notch. A good place to start to just see if your eyes are responsible for that is it's a really quick test. So you just kind of move your head left, right, up, down, side to side, and just kind of get a general feel for how much motion is there. And then close your eyes and do the same thing. And if your range of motion is bigger with your eyes closed, then you should start doing those gaze stability exercises. Do you remember those? You've probably done a sickening amount of them at
You
this
stare at
point.
the dot on the wall and you turn your head. Yeah.
Yep.
Yeah. But
So
I mean, this is also, I don't want you guys to just start staring at dots and turning your head. Like find a practitioner to help you with this because it is different for everyone. But he's explaining what can help the headaches to go away.
yeah, and this is just a good way to figure out if that type of doctor is going to be helpful for you is just making sure, if your range of motion is much larger with your eyes closed, then that tells you gaze stability will likely help. And then that would give you a tip off of, okay, I should probably find somebody that practices functional neurology. And it's just a nice way to make sure that you're going to see the right kind of doctor, because the more people I see, the more of a struggle I've learned that is to find the right help at the right time. That's probably the most important thing right after a concussion, is just making sure you don't go to the wrong type of doctor.
Yeah. And, wrong is a subjective term, but, wrong for you. Because,
wrong
right.
For that time. Yeah.
Yeah. Yeah. Because, like I know that I have not found much success with neurologists in helping too much, but I know other people who have. So, it just depends on it depends on you and depends on your person. It's interesting you mentioned the relationship between the neck and the eyes. I see a chiropractor. I went to him because he had some neurology background, and so I had been having these headaches behind my eyes, and like I've been having issues with my neck and my jaw, like a TMJ issue, and he was like working on my neck. He said, "Hey, sometimes people who have issues on their neck here get headaches behind their eyes." And it was like a light bulb went off, and I was like, "Oh my goodness. I had no idea that could be related." And so it's interesting you bring up, because maybe it goes both ways. Like if your neck is off, it can cause headaches behind your eyes, or if your eyes are off, it can cause headaches in the back of your neck.
Yes, absolutely. A great example that someone once explained to me, just kind of imagine if you're driving your car at night and your headlights are on and they kind of shut off for a second and then turn back on. Like if that was you, that's actually happened to me. It is terrifying. Your hands grip the wheel really hard, your whole body tenses up. You're just trying to create stability for that car because you can't see where you're going. And so if you remember the test that we always used to run on you, the VNG, where you sort of follow the dot back and forth. So what we look for in that test is for the eyes to kind of jump off the target and come back on. And so for your brain, it's kind of like the headlight analogy is your vision suddenly stops and then just comes back online. It's very quick. It's very hard to kind of feel when it's happening. But one of the ways in which your brain will compensate for those slight lapses in movement is to wind up the tension in your neck, specifically right where you were just mentioning, to stabilize your head. It's the same way that your hands would tighten on the wheel when the lights shut off, is when your eyes kind of glitch out like that. The system needs more input to not have that happen. And the easiest way for it to do so is to wind up the neck, because those neck muscles plug in right on the top of the neck. And when they lock down, your head just doesn't move as well. And that makes it less likely that you're going to have those temporary lapses in vision.
Interesting. Yeah.
Yeah. And in the same way, I mean, the system is so integrated. It's actually quite interesting when the vestibular input, the ocular input, and the neck input come into the central nervous system. It's a very unique place because there's no additional processing before that input is put into your body. That's why if you see enough of these, you'll see people's head is like this or tilted to one side, and they
I
think
had that.
Yeah, because you think it's
Yeah.
normal. It feels normal to you because of that reflexive output. Like your brain doesn't process that at all. It just gets immediately spit out into your body. So in that sense, it makes a lot more sense that stuff with your neck could influence stuff with your eyes just because of the way information is processed there. And that's why, that's kind of the first thing we look for in a post-concussion case is like, if your head is tilted to one side and then you straighten it and they feel super weird, there's definitely an imbalance in the integration of that. And that's at a super
Mhm.
high level, kind of the big thing that we look for.
Yeah. And that was me for so many years. And I had a head tilt for over 10 years. And I was growing because my brain injury happened when I was 14. And so that's how I developed TMJ on one of my jaws because
Mm.
my head was tilted for so long. This one side of my neck, that my head was always off. And so, like, with the one side of my neck and the one side of my jaw got completely off as, I continued growing. And as if you spend over 10 years with your head like in a awkward position, but you don't know it because my vision was off. It caused, issues that I now have to deal with. So yeah, but when it comes to headaches and migraines, I hope what you're getting from this episode is that there's a lot of different causes for them after a brain injury, and there's a lot of things you can do with it. There's a lot of things you can do for it. So I do want to talk about medication because I saw neurologists for many years that had me on all sorts of different medications for my headaches. And at the time, I was so grateful for it because I literally couldn't get through. But it caused a lot of side effects and issues. And I had to get off of it and then try a different medicine. Then that caused side effects. And then, it's just like this whole process of trying to figure that out. And I wish back then I had somebody say, let's look at your neck. Let's look at your eye movements, instead of just sticking me on medicines for years. And no judgment if you're on prescription medicine for your migraines and headaches. I'm so glad that you have something that's helping you right now. But I hope that you know that you don't have to live like that forever.
And I couldn't have said it better myself. Yeah, it's helpful a lot of the time. I know it's easy to kind of, I guess it's hard to pick a word, but kind of demonize, I guess, like the medical establishment is not trained to treat acute concussions. That's just not what they're there to do. They are there to make sure that you are safe. And for that reason, they are extremely important. When you have a head injury, it's important to make sure that you didn't cause a brain bleed. It's an important thing to make sure you didn't permanently damage the neck tissue. All of that stuff should be done first. It's just, I don't think there's a very clean process for understanding when to hand people off to
Yeah.
the appropriate care. I think that the impulse is to continue treating with medication even when they're not responsive, which in the migraine community is kind of all of what they get. They just sort of start there. And if that doesn't work, they keep trying things. And eventually that leads to a really difficult sort of experience on this pharmaceutical merry-go-round where they just keep cycling on and off medications and they keep
Yeah.
trying more. Eventually their body can't detox all of them and they get actually additional headaches called rebound headaches. So they have
I had
headaches.
that. Yeah. And then I had a neurologist tell me, like, oh, well, you're taking this medicine every day. So you're going to have rebound headaches. And I'm like, wait a minute. Like, or no, from taking the medicine, you're going to have rebound headaches. And I'm like, wait, so this medicine is supposed to help my headaches, but it's also giving me headaches.
Yes. Yes. I'm so glad that you see the illogical loop in that. It's like,
Well, I lived it for like 10 years. I lived that. And so, like, I have so much compassion. And also, I don't think I could have gotten through college without the medications. So, like, I'm grateful for them. Like, I was on Topamax, and yeah, it caused so many issues, like side effects that I didn't know was happening. I lost over 50% of my hair. Like, metabolically, it just destroyed me. I didn't know. But I was able to, get through the day at the
yeah,
time. And now I wish I never went on it, honestly. But, you know, at the time it was what I needed, I thought, or it was all I had. So, but remember, I want to say two things. Number one, it's different for everyone. And so he's just explaining these are some things that you can get tested for. And number two, post concussion and post TBI headaches are different than migraines for somebody who's never had a brain injury. And can you explain that a little bit?
Yeah, absolutely. There are so many post-concussion headaches kind of masquerading as migraine. And the surest way to figure out which one is which is if you started getting migraines immediately after a head injury with no history of them, you probably don't have them. The typical migraine patient will start having them right around the time they hit puberty, and then they'll just kind of have them forever. It's kind of in it for the long haul type of deal. That's what true migraine is. And true migraine typically responds much more favorably to the medication. You'll notice an immediate relief from it. If you had a concussion and then you still have all of those symptoms, and the symptoms being, light sensitivity, nausea, fatigue, a pulsating quality, like all of the diagnostic criteria for migraine looks a lot like post-concussion. But if you just started getting them after the concussion and you don't respond to the medication, it's likely that you just have post-concussion syndrome and you've been misdiagnosed. And I tell you, I won't get on the soapbox, but that is a huge frustration of mine, because you just said it, like imagine taking Topamax and not having it help at all and just getting the side effects.
I mean, that's pretty much, I still had headaches, but I thought like, they were better than before I had it, but I still had headaches because I didn't have headaches before the brain injury. And so it's like, it's just crazy because it was all brain injury related. And I saw a neurologist that was considered a headache specialist. And I tried shots, I tried pills, like so many different things. And I never really found relief. I just found myself cycling through trying different things.
Yeah, absolutely. Fun side fact. Do you know what Topamax is primarily used for?
Seizures, I think.
Yeah,
Yeah.
epilepsy.
Yeah.
It is an intense, heavy drug, and it just sort of bothers me that they hand it out so cavalierly with people that
So
they're not
many
even sure
brain
if
injury
it's
people have it.
migraine.
Yeah. So many people with brain injuries get put on it.
Yeah,
Yeah. And
and
then I saw one of the side effects on it is confusion. And I'm like, wait a minute. Like, what are the side effects? Like, the side effects of Topamax are cognitive dysfunction. So, like, I was in this like fog of like, is it a concussion? And then I was on this medicine that was supposed to help that made me feel worse.
yeah, they
So,
call it Dopamax is
I
the
heard that. Yeah.
for I just to be completely honest, you are a total beast for making it through college on that. I can't that's one of the more impressive things I've heard, because that stuff is no joke.
And I mean, I didn't know. Like, all you know at the time is what your doctor tells you, right?
Yeah.
And you trust them because you don't have, and at least they took me seriously. At least they took my headache seriously. At least they were trying something. And I just thought at least I should try something. I don't know. I want people to know there's a better way. Headaches outside of brain injury is super different than a post concussion headache. So if you're seeing a practitioner that's a neurologist that specializes in headaches and migraines, they might be trying Botox or trying all these different things that they would do on a migraine patient instead of seeing a doctor that specializes in brain injury. That is the type of doctor that could probably help your type of headaches. And the research is still so new, and there's still so much more coming out that it's like you need to see somebody up on current research, not someone who's been in practice for 30 years and hasn't changed what they're doing.
Absolutely. That is beautifully said. And I think it is important to know that if you're listening out there and you do have migraines and you know it's migraines and not post concussion, you could greatly benefit by focusing on sort of one of four areas. So, neck, a lot of people respond really well to a type of chiropractic called upper cervical chiropractic. It's very gentle, it's very specific. If you have reservations about the loud pops and aggressive like adjustments that you think of with chiropractic, it's the opposite of that. It's very gentle. Any sort of functional neurology rehab is the second bucket. Something that Christabel and I were talking about immediately before this is something called the Dutch panel. It sort of looks at your stress output and tells you if that's affecting how your hormones are being metabolized. Huge issue with migraine. If you have somebody close to you that can look at that and give you supplements for that, absolutely monumental for migraine. And then nutrition. The cheat code for migraine nutrition, without going too in depth, is learn how to stabilize your blood sugar through low glycemic foods. If you look at migraine more as sort of more similar to a seizure than a headache, a lot of the research on diets for conditions like epilepsy and migraine have to do like with keto and paleo, and all of those diets are very, very good at keeping your sugars nice and stable. Because when you tank your sugar, then an already unstable nervous system is much more likely to sort of gets really squirrely and dysfunctional when it doesn't have enough sugar. So if you're out there and you're hearing this and you're wondering where to look for migraines, those 4 buckets are the big ones again. So neck, neurology, nutrition, and hormones.
So good. I'm glad you mentioned nutrition. Sometimes I feel like my audience gets tired of hearing me talk about nutrition because I feel like it comes up in every episode and I don't want to seem like I'm like on a soapbox about it, but it's changed my life. It's changed the trajectory of my recovery. And for me, gluten-free was the key. Ever since I went gluten-free, like I used to call them migraines. I guess they're not true migraines, but those intense headaches that had me in the bed, that in a dark room where I couldn't do anything, they were all basically eliminated ever since I went gluten-free. And so it changed my life.
That's so great. That's so great to hear. And if anyone's tried that in the last 10 years, I promise you they've come a long way with gluten-free alternatives, because you can attest there's some good stuff. It's not as difficult as people think to go gluten-free, and it makes such a big difference.
Yeah, it really does. It really does. And, I recommend seeing a naturopath or a functional nutrition somebody, because I have a doctor that's helping me through it. So, you can try these things on your own. And that's what this podcast is about, giving you the knowledge and education to know what to do. But it's always better if you get some blood work done, you get some testing done, and you have a doctor directing you on what supplements to take, because you don't want to just take like a billion supplements on your own because you don't know how they interact. You need somebody who's trained to be able to be like, yeah, this is going to help you. And Dr. Thompson, I want to ask you about magnesium for headaches. That was actually recommended to me by the PA at my neurologist's office. So like I would see him once a year and I would see her the other times because he's busy, I told her like I tried like the CGRP shots. If you guys have heard of like Emgality or Aimovig or Ajovy, I tried the Ajovy and I was losing hair, and it felt like all of my other brain injury symptoms were like 100 times more, but the pain was gone. What that basically does is it blocks like your pain blockers. So for people who suffer with true migraine, those are like life-saving. But after post-concussion, I felt like it made all my other confusion and overwhelm, and then I didn't have the tell of the headache to tell me when to stop. And so like I'd push myself past my symptom limits without knowing I was doing that. And then like I was just in this cascade of chaos. I'll say it. So when I got off that, I didn't want to do it anymore. I was like, I'm done. Like I can't keep taking these meds. This was, I think, 2019, the beginning of 2019, before I ever saw Dr. Schmo. And the PA recommended, hey, why don't you try magnesium? She was younger, and I think she had different training than he did. And so she recommended magnesium for headaches at night. So I started on magnesium.
Yeah. Did they give you any advice on what type? There's so many different.
Yeah. I heard magnesium 3 and 8. Did I say it right? That's the best for brain, right?
Yeah, that's more readily able to cross the blood-brain barrier. There are different combinations of it, and you have to be careful on which one you recommend for headaches. But yeah, whoever gave you magnesium threonate, it's probably Dr. Schmo. I know he gives a lot of something called Optimag Neuro, which is an amazing company and an amazing supplement. It's especially helpful at night for sleep. I know a lot of people will take magnesium supplements to help them fall and stay asleep. It's also very important in the headache world to stabilize the difference in charge across the cellular membrane. Those are big words. It basically just means you need a big difference in charge from outside to inside. And that's one of the things that's just genetically different with migraine, is you have these leaky channels that makes that difference very small. And the smaller the difference in charge, the more easy it is to discharge it. So supplementing with ions, electrolytes rather, so sodium, potassium, and magnesium is a really nice way to make sure that difference in charge from inside to out is very large, because that means the neuron is much more it's much more stable. That's really what we're trying to do with brain injury rehab as well, is if you take an unstable neuron with a very low difference in charge, just stimulating it and activating it is enough to create a larger difference. And then that specific neuron is much less likely to fatigue. So
Okay.
that's predominantly the thought process for taking magnesium. And honestly, anything you can do to help you sleep, I would say is worthwhile. Sleep is such a key thing to just make sure you can recover fully.
Hmm.
Did you have trouble sleeping after your
Oh
head
yeah,
injury?
they put me on trazodone for.
Ooh.
I was on that for so many years. I actually just got off it. Yeah, because I kept trying to wean myself off of it, and then I kept getting re-injured, and it was like, so yeah, I had to take medicine to sleep, and I kind of wish that I was taught about sleep hygiene rather than just put on medicine. But when I first got injured, like I had no, like I was really like I couldn't get dressed, I couldn't get, like they were just like, let's get her to sleep for it for anything possible. We just need to get her to sleep.
Hmm.
But I wish that somewhere in my recovery in those 10 years, somebody would have said, one of my doctors and practitioners would have said, okay, well, now you're able to reason a little bit better. Why don't we try something different? So that, but I finally got off it, and I'm sleeping better than I ever did on the medicine.
Oh, that's so good to hear. It's a different type of fatigue. It's like, it's so frustrating when you're like, I know
Yeah,
all I need to do to feel better and more energized is to sleep. And I'm tired when I go to sleep, but I can't fall asleep.
I can't
It's like
stay asleep. Yeah.
such a
Yeah.
paradox.
So we're running a little low on time. I have two more questions for you. The first one is like if you wanted to like wrap all this up in a little bow for somebody who's listening, brain injury survivor, caregiver, somebody who's looking for help in this area, what are the top things that you would say about headaches post injury?
So the first and most important thing is make sure you know what type of headache you're dealing with. So if you had a concussion and this is the first time you've ever had migraines, I would go to somebody that specializes in post-concussion headaches. If you've had migraines your whole life, then had a concussion and now your migraines are worse, then you could benefit from looking into the one of four different types that we talked about. So look into a nutritionist, find somebody to run a Dutch panel and fix that, find somebody to take care of the neck issues, and then find somebody to take care of the neurologic issues. The treatment looks much different for each. So making sure that you know exactly what you're dealing with before is helpful. Even if you've been diagnosed, make sure you do your homework and figure out that type.
Mm-hmm.
And I would say the biggest thing to the caregivers is just be patient, compassionate. I mean, you may not understand it. I didn't understand migraines for a very long time. And then looking back at how I would treat people with them, I really wish I was more patient because I just did not understand their struggle as well as I should. So um, just know it's they would do anything to have less. And having a patient and compassionate spouse or really just friend, however you're giving care, it helps a lot. So just sometimes all they want is to feel heard and just want someone to listen and not necessarily tell them what to do. That's one thing I've had to learn with my wife who has migraines, is sometimes to just listen and just really just be a compassionate friend is a lot of times all they want. So that would be my recommendation on experience as a caregiver for someone with migraines.
Yeah, that's great. And while you were talking, I thought we didn't mention this earlier, but you mentioned how vision causes it, but vestibular issues probably cause headaches too, especially if you're dealing with dizziness. Sometimes maybe treating your vestibular system if you have dysfunction there. Like you mentioned before, treating the vision can help, but I just thought of that.
Yeah, totally. That's kind of
That's
the
under the
really
post concussion umbrella, right? Yeah.
absolutely. Yeah, that's the first thing that I choose to start with. It's one of the first systems to develop when you're a fetus. So generally, you want to treat that first since it's so foundational. And so generally, the order of operations with a really bad concussion is you look, okay, put your eyes in the dark, and if your eyes are just bouncing everywhere in the dark, then you know you have vestibular imbalances. So the system is going to go, okay, well, vestibular system, you're out. We usually listen to you the most, but now we're going to listen to vision or neck the most. And so it kind of takes an inventory and goes, okay, well, how's the vision? We look at the VNG testing, and if you can't look up and down, side to side, if you're super inaccurate with your saccades, then your brain goes, okay, well, vestibular's out, vision's out. Let's just jack up the tension in your neck and call it a day. And that's the constellation of different things that make just rock hard headaches that don't respond. And so that's another tip. If you're out there and you've tried everything for your headaches and nothing seems to work, that would be a great time to go check your vestibular system and see if that's the root cause, because I can't tell you how many times we've seen people like that, put them in our vestibular rehab tool, do a couple spins, even out that integration, and then their neck just feels like a stick of butter for the first time in like 10 years. That's how you know the root cause of it was a vestibular imbalance. And it's so shockingly common. Side note, it's really, really difficult to sleep if you close your eyes and you feel like you're moving. So all the more reason to check your vestibular system if you're having sleep issues as well.
Yeah, there's so much. There's so much. And, I had these issues too, but I didn't get vestibular diagnosed because I could walk. Right. So, like, it took many years to find a practitioner that was like, oh, yeah, your vestibular system is completely messed up because, I was upright. So, like, I mean, barely, but I was upright. Right. So it's like when the regular brain injury checkup doctor that I see, because I was seeing so many doctors, she would be like, okay, walk down the hallway. All right, she can walk. You know what I mean? Like that. It was never really tested until I went to see Dr. Schmo, like the specifics of it. So yeah, it's really, really important.
Totally. That kind of goes back to, some doctors are looking for the really, really bad things. Like if you're so vestibularly imbalanced that you feel like you're spinning on a roller coaster the entire day, they'll pick those things up, but it's those subtle differences that you just need a different type of doctor. And that's helpful to know, because a lot of times if you feel like you're normal and then they diagnose you with something, it's just helpful to get the full picture. It can just put you at such ease.
Yeah.
And you can attest to that. I mean, when you finally figured out how everything was working, it's just, it's like a
Life-changing.
weight that just gets lifted. Yeah.
Feels so free, honestly. All right. So last question. What are your words of hope that you would have for our listeners?
Words of hope, I would say that it's okay to be frustrated, and it's okay to feel like people don't understand, and it's just not okay to direct that frustration at yourself. Your journey is hard enough. You don't need to put extra things on top of it. The only way you can let yourself down in this is if you just stop looking for help. That would be my big thing, is don't take it out on yourself and just keep looking, because it's out there. You just need to look a little further in some cases.
Wonderful. Thank you so much, Dr. Thompson. So if people want to get in touch with you, can you share your website and social media info?
Yeah, the website is www.mnmigraineandconcussion.com. And I make a lot of content on TikTok. My handle is headache_whisperer for everything migraine and concussion.
Wonderful. Thanks so much, Dr. Thompson. Really appreciate you taking the time.
Oh, thank you so much, Christabel. I'm wish you nothing but the best. And if I can support you in any way, please let me know how.
Thank you.